What is PRP and how is it used?
PRP stands for platelet-rich plasma. And so what we do is we take some of your blood, that's like your whole blood, and when you spin that in a centrifuge, the heavier parts, go to the bottom. And so all the red blood cells kind of go at the bottom. And then there's like a little layer of white blood cells on top. And then above that is sort of a yellowish serum or plasma. And the platelets tend to congregate towards the bottom of that plasma layer. And so right above the white cells. And so if you spin blood down with the right type of equipment in the plasma layer, if you take the bottom half, that would be the platelet-rich plasma, or that's where the platelets are concentrated. And so that's platelet-rich plasma. And so it's used really lots of places in medicine. It is very useful. And then it's also sort of misused in some places. So orthopedics, neurosurgeons are using platelet-rich plasma to inject around joints that are inflamed or have maybe a torn ligament or a strained ligament. And it kind of helps with inflammation and to bring in some of the growth healing factors. And so we've recognized some of those advantages in plastic surgery as well. So on all my facelifts and necks and different procedures we do, we'll spray in platelet-rich plasma with thrombin and sort of make your own glue that is PRP as well. And we think it helps limit the swelling and bruising in the patients and makes them sort of recover a little bit faster. It can be misused. So in order for PRP to work, it has to have access to the body and some type of inflammation. So if you were to do a microneedling procedure, which would make thousands of little needle sticks all over your face, which would create, again, thousands of little injuries, and then you put PRP in, the PRP can go through the needle sticks into your skin, see the injury and inflammation, activate, release its little goodies that it has, and attract lots of healing factors and help your skin recover. And so we see on laser patients in the recovery room, when we place it on top of their faces, we'll watch the redness sort of reduce almost immediately as the PRP gets working. Where it won't work is just like putting it on the outside of your skin because there's a berry there. It won't really do anything. There's also people who will just inject it and sort of pretend like it would work like a filler, but because you're just injecting an area and there's not really any inflammation or injury, it's not really going to do a whole lot. You're taking blood out of your body and just kind of putting it back in. And so you want that the platelets to be around some sort of injury inflammation, and then that really revs them up to go and get to work.